Hey guys, welcome to Tuesday Talks with the Green Bay Doulas. I'm Emily Jacobson, and I'm here with Anja, our local amazing midwife, and happy International Midwifery Week.
Yay. Thank you. I'm so excited to be here.
And so instead of me just sitting here ranting about midwives, I figured I would actually have an actual midwife and
An
let's learn a
actual
little bit.
Sure.
So, Anja, we're going to go basic. What is a midwife?
Yeah. So a midwife is a primary care provider. So they can take care of you from your first pregnancy test positive to 6 weeks after your baby's birth. Um, so I'm a CPM, certified professional midwife, and I am licensed in Wisconsin to provide care for women in out-of-hospital settings. But there are hospital-based midwives as well, CNM, certified nurse midwives, and they are women's lifespan primary care providers. So in both cases, midwives, there are certain things that that we can't attend to, but we can always just be assessing and collaborating with physicians and move people on to higher level care if they need that.
Okay, perfect, perfect. So, with COVID and a pandemic happening, how has that changed midwifery? How has it brought light to midwifery? Like, how has it affected midwifery? Talk all of it. I want to know.
So I think that the pandemic has unfortunately laid bare some of the disparities in our healthcare delivery system that have been there all along, but have become much more glaring with this additional layer of a runaway virus. And so I think that people are realizing that they want the personal touch of a midwife, the individualized care, and that is a valuable thing really for all pregnant people, regardless of your background, your skin color, and who you love. And so I think that we can start to see how midwives and more midwives could be used to really become an integral part of the healthcare delivery system to address some of those disparities.
Yeah, awesome. Okay. So I would say for those looking or might be interested in midwifery care, like when do they call? Who qualifies? Like what does that look like? If I find out I'm pregnant, I'm like, "Oh, but I would prefer not to birth in a hospital. I'm looking to maybe just do a home birth." What does that look like? Because it's not just a home birth. There's a lot of preparation involved. So
Exactly.
when should people call? Who should call? Like, what does that look like?
Well, I think anybody can start out by calling a midwife, right? Like, so you don't have to be in the position of deciding already that you're not an appropriate candidate for a midwife's care or a home birth. And then the midwife can work you through that. Most home-based midwives have social media presence or websites. There is a state organization, the Wisconsin Guild of Midwives, that has a listing of midwives in the state. So that's kind of how you would find a home birth midwife. And certainly then hospital-based providers are with larger physician groups typically. And so they would reach out to those people. So anybody can always call a midwife. And then we just need to, understand what your history is and what your potential risk factors are, and work through whether or not that person is healthy and low risk for out of hospital birth, in my case, or healthy and low risk enough for midwife attended birth in the hospital. So,
Perfect. All
yeah.
right. Well, enjoy your week. Celebrate
Yay!
it. Are you going to do anything fun?
Always do a little something fun for myself, right? If I'm not on call.
When aren't we always on call? That's
Yeah.
just the life. Well, thank you, Anja. I really appreciate it. And happy
Yay.
midwifery week.
Thank you.
Bye.
Bye.